For surgical description, the interior of the anal canal is divided into three parts. That is upper part, middle part and this lower part. The upper part of the anal canal, you can see, extends from the anorectal junction to the pectinate line. So here we have the pectinate line. It is 15 millimeter in length. The upper part of the anal canal has got some special features. They are, you can see some column like mucosal fold. We call it as the anal columns. Anal columns. What are anal columns? Anal columns are permanent longitudinal mucosal fold. The upper part of the anal canal is the continuation of the rectum. Okay, so the interior of the upper part consists of some longitudinal permanent mucosal folds. They are known as the anal columns. There are 6 to 10 anal columns are there. 6 to 10 anal columns are there. And inside the anal column, we can see the superior rectal artery. So here we can see the superior rectal artery. Superior rectal artery. Superior rectal artery is present there. Okay, so here we have anal column. There are 6 to 10 anal columns are there. Okay, and next one is the anal valves. That is the lower margin of. Here we can see this is the first one anal column. This is another anal column. The adjacent anal columns, lower part of the adjacent anal columns are connected by means of crescentric mucosal folds. These crescentric mucosal folds are known as the anal valves. Anal valves. Okay, see, I am just drawing. So here this is the longitudinal mucosal fold. Okay, this is one mucosal fold. This is another mucosal fold. The adjacent mucosal folds are connected like this. Okay, so this connection is known as the anal valve. So these all are the anal valves. Okay, this anal valve has got a margin over here. It has got a free margin, and here there is a cavity. Okay, inside there is a cavity, and this cavity is known as the anal sinus. Anal sinus. Anal sinus. Okay, and this anal sinus has got a cavity which is directed upwards, and there is a surface which is directed downwards. Okay, there is a surface upwards and downwards. Okay, they are the anal sinuses, and the free margin of these anal valves. Okay, this free margin of these anal valves, and they are connected to form the pectinate line. That is the pectinate line. You know, pectinate line is the junction between endoderm and ectoderm. Area above the pectinate line develops from endoderm, and area below the pectinate line develops from ectoderm. And inside these anal sinuses, so you can see anal glands are opening into it. Anal glands are there. Anal glands are opening into it. Anal glands. Okay. Now let us see the middle portion. This is the middle portion. Okay, that middle part. Again, the middle part is 15 millimeter long. This part is also known as the pecten. Pecten. Middle part is known as the pecten. So this part is lined by the epithelium is non-keratinized stratified squamous epithelium. Non-keratinized stratified squamous epithelium, whereas this upper area is lined by columnar epithelium. Columnar epithelium. Remember this point, columnar epithelium, because the upper part is the continuation of the rectum. So the same mucosa which is lining the rectum also lines the upper part. That area does not have any sweat or sebaceous gland. There is no sweat and sebaceous glands are present in this area. Okay. Now let us see the lower part. Lower part. Lower part is 8 millimeter in length. This part, it is lined by true skin. We have true skin over there. So the epithelium is stratified squamous keratinized. Stratified squamous keratinized epithelium. So here area above that pecten is lined by stratified squamous non-keratinized. The area is stratified squamous keratinized. The junction between these two, okay, is marked by a line that is known as the white line of Hilton. That is known as the white line of Hilton. Remember, the white line of Hilton separates the middle and lower part of the anal canal. Okay. What is the color of this middle portion? So middle portion is bluish pink in color. Bluish pink in color. The upper part is pinkish, middle part is bluish pink, and the lower part is same as that of the color of the true skin. Okay, why it is bluish pink in color? You can see that this area above we have superior rectal artery and superior rectal vein is there. Superior rectal artery and superior rectal veins are there, and this area we have inferior rectal vessels are there. Inferior rectal vessels. Okay, so what happens in this area? There is a vast anastomosis between the superior rectal, middle rectal, and inferior rectal. Superior rectal, middle rectal, and inferior rectal. There is a vast anastomosis between three vessels. Because of these three vessels, this particular middle area appears as bluish pink in color. Bluish pink in color. Now let us see new two terms, that is anatomical and surgical anal canal. Okay, what do you mean by anatomical anal canal? Okay, anatomical anal canal extends from the pectinate line. You know the pectinate line, and to this anal verge, the whole area. Pectinate anal verge means that opening. Okay, that is anal verge here. From the pectinate line to this anal verge, that is known as the anatomical anal canal. Anatomical anal canal. You know, anatomical anal canal is ectodermal in origin. Ectodermal in origin. Okay, and what do you mean by surgical anal canal? Surgical anal canal. Surgical anal canal, the whole extends from the anorectal junction to the anal verge. Anorectal junction to this anal verge, the whole is known as the surgical anal canal because it is surgically important. You know the hemorrhoids, like internal hemorrhoids occurs at the upper part, and the lower part we have the external hemorrhoids. Then we have the fissures. All these things are happens whole length of this anal canal. That is why it's known as the surgical. The whole anal canal from the anorectal junction to this anal verge is known as the surgical anal canal. From the pectinate line to this anal verge is known as the anatomical anal canal.